evening, friend. So we are here to discuss about the OET speaking and what should we do in a initial 3 minute of a speaking preparation time. In the exam, you will be given a preparation time of the 3 minute and role play time of the 5 minute. So no matter how much you have practiced the speaking task at your home, at the classes, if you doesn't learn that how to utilize those 3 minutes wisely. See, both the scenario are very different, like practice at the home and a examination hall. For example, stress level is a very much high in the examination hall. Your mind gets saturated after a listening, reading, and writing. And even though if any of a task is not performed well, then the tension level is increased also. So taking consideration of all the above things, you should be very well prepared to overcome the any challenges during the exam and control your nerves to minimize the stress level. Once you learned how to reduce the stress and being calm, even though your previous tasks were not performed well, then the victory is yours. I can understand it is easy to speak but harder to control the mind during the exam. But with a good practice and learning technique, we can definitely reduce it. So today I will teach you how to utilize that precious 3 minutes. It is totally depend on four things. First is the length of the task, second, your reading speed, third is how much you understand from the task, and fourth one is your previous practice at the home or the classes. See, there are some rules while practicing at the home. First rule is never look at the patient task. Therefore, I did not give the patient task below. Second one is read faster as much as you can because my examination task was lengthy enough to take up 2 minutes to read it and 1 minute to understand it. And third one is do not misunderstand the task. Here I gave the example of a speaking task to get a better understanding. It is from a sample test 1. So just read the task and then after we will continue our video. So mainly there are two type of tasks in the exam and any of the tasks can come in your exam. First one is the explanation type, like there is a new disease, asthma, arthritis or any other diseases and any procedures like CT scan, MRI to be performed for further diagnosis. It is a relatively easy task because you know your medical knowledge. And second one is a sympathy type of task like physiological process, like a parent come with their children and complaining that their child are short and there is a difficulty with toilet training and some patient come with a smoking and alcohol history and for come for the cessation of the smoking and alcohol. It is a relatively tough because you have to explain and sympathize the parents that everything will be fine and it is a normal to have this kind of condition at this age, and once the time come they will learn by their own, and so it is a difficult to sympathize the parents, or it is also difficult to reduce the alcohol and smoking level. So sympathizing someone is a very tough task, but it is achievable with some practice. So first thing what to do when the task arrives in your hand, like decide it is either a first visit or it is a follow-up visit, because this determines how your task will be started. I explained you in a previous video how to start your conversation in any of the above, like first visit or a follow-up visit. Then after you should focus on the time management. Initial 1.5 minutes, try to read the whole task. See, look, it is impossible initially, but don't worry, with the practice it improves. Later 1 minute, try to collect the extra information which you like to add, like new onset of the pain, OD para. You should write this on the paper and remember it. O means origin, where the pain exactly is and how it started. D for the duration, when did it exactly started. P for the pain scale, from 0 to 10, where do you put your pain. Aggravating factor, R for relieving factor, and A for associate with any other complaints. You should speedily write the criteria which you usually forgot during the practice. Example, what do you think you might be causing your symptoms? Giving the leaflet, summarize at the end, or any of the criteria which is easily forgotten by you during the practice. Please go through all the criteria which I explained in my previous video, which is really important because you will get score or marks based on that criteria. Remaining 30 seconds, make the impression of the introduction in your mind that what I will speak initially, because the first impression matters and it also boosts your confidence level. So always spare some time for the introduction part. It might be possible that you won't have some time if the task is lengthy, but you can know from the size of the task in the initial 1.5 minutes. So manage it accordingly and try to do as much as practice at your home of a lengthy task. If you can't determine that it is a first visit or a follow-up visit, then the safe way to go is a hello, Mr. Patel. I went through your case note. It suggests me that you are suffering from arthritis. I am very sorry to hear about that, but it would be easy to understand for me if you speak in your own words that what is bothering you so much. In the given task is a sympathy type of the task, and it can be considered as a follow-up visit or the first visit. After that, focus on the first word of each task, like find out, advise, explain, reassure, and provide the recommendation. These keywords help you to frame the new question and initiate your further conversation. Example, okay, Mr. Patel, I am extremely sorry to hear about your condition. Let me find out what worries do you have? Can you explain me briefly? This is an open type of question. Patient says, I am worried about the outcome of my myocardial infarction attack. Doctor says, it is understandable that you feel some fatigue, and some fatigue is expectable also. You will regain your full strength within some weeks, so don't be worried. I would like to advise you to join the cardiac rehabilitation program. And let me explain you the importance of the exercise. Let me reassure you for further prevention of the attack. I recommend you so complete all the sentences from the case note. And at the end, ask the patient, so are you getting my point? Is there anything you want to know from the me? Patient says no. And at the end, the summarize. Let me summarize what we have discussed till now and give the leaflet. Here is the leaflet of our hospital, having the information about the your disease and just go through it for the better explanation. So thank you for putting faith in us and have a nice day. This whole conversation should run in your mind within a first 3 minutes. It totally depends on you that what things you want to write in the paper and what you will recollect without writing during the exam. Example, in my case, I wrote down these things which I usually forgot during my practice with my friends. Example, what do you think what might be causing your symptoms? Giving leaflet, summarize at the end. You can write down your own things. Okay, so always remember that the introduction is a very vital part of your conversation. So try to improve it and memorize all the speaking and writing criteria before going to exam. It doesn't matter that how the interlocutor performs. If you perform well, then you will get required score easily. Be the confident in exam. It doesn't assess your medical knowledge, it assesses your English proficiency. So it is wisely to give an antacid for the headache, but it is unwise to have a grammar mistake, lack of politeness, lack of sympathy, lack of confidence, and mainly the lack of active listening. So I think it is all from my side how to utilize the 3 minute wisely. Any suggestion from you is a highly acceptable.